My name is Karen McFadden. I live in Forest Heights, Maryland, with my husband, and I live with 3 children. I do have a little dog, Mustard, who's my favorite. I'm a fitness instructor. I love to teach. I love to just enjoy, have a good time, party. I had ongoing periods. I didn't have a start or end date, and it would be heavy flow ongoing. And that went on for quite a few years. All of a sudden, I just would bleed for a month and a half. Sometimes I would bleed for 3 weeks, stop for a week, and I'm bleeding again. And my heavy period limited me from swimming, going to the beach, and having fun, just putting on whatever I wanted to and going wherever, not having to worry about, do I have enough coverage in my purse? It became a way of life for me at that time that, there was just no solution. And then I switched doctors, which was the best thing ever. I remember talking to her, and she just felt more welcoming. So I just told her, this is crazy. I shouldn't be going through this. She did a few things at first. She performed, I believe it was a DNC. She tried to put me on birth control. Once that all didn't work, she, handed me a pamphlet, and she said, "Have you ever heard of NovaSure?" I had the NovaSure about 5 years ago. I remember it was in August 2012. I noticed that the change about 2 to 3 months after. I was able to kind of predict my periods a little bit. I didn't have to wear the super overnight pads, so that was great. But I didn't have to use the extra thick ones, or the super thin ones. As time went on, it started to get more regular, and it was light. And it was different from me because I've been so used to all these years having a heavy period. Pre-NovaSure procedure, life was unpredictable. Whenever I wanted to go and do something, I had to always have my little bag just in case. And that limited me a lot in my day-to-day. After the NovaSure procedure, it was a relief. I don't have those issues. I can I plan my vacations, because I know when my cycle is coming. I have so much positive to say about being able to wear white. I can wear it when I want to. I am so blessed to have ran into this particular doctor who introduced me to the NovaSure. I wish I'd have known that there were options earlier. I would definitely recommend the NovaSure procedure to anyone who would say they are experiencing heavy bleeding. And I just tell them it changed my life.
Pivotal study information. In a pivotal study, 175 women receiving the NovaSure procedure showed a 1-year success rate of 77.7% and 1-year amenorrhea rate of 36%. Patient success was based on a reduction in a menstrual diary score indicating menorrhagia pre-treatment to a diary score indicating normal to no menstrual bleeding at 1 year post-treatment using a validated scoring system. The NovaSure procedure is not for those who have or suspect uterine cancer, have an active genital, urinary, or pelvic infection, or an IUD. NovaSure endometrial ablation is not a sterilization procedure. Rare but serious risks include, but are not limited to, thermal injury, perforation, and infection. Temporary side effects may include cramping, nausea, vomiting, discharge, and spotting. Important safety information. NovaSure endometrial ablation is for premenopausal women with heavy periods due to benign causes who are finished childbearing. Pregnancy following the NovaSure procedure can be dangerous. The NovaSure procedure is not for those who have or suspect uterine cancer, have an active genital, urinary, or pelvic infection, or an IUD. NovaSure endometrial ablation is not a sterilization procedure. Rare but serious risks include, but are not limited to, thermal injury, perforation, and infection. Temporary side effects may include cramping, nausea, vomiting, discharge, and spotting. Inform patients to contact you if they experience a possible side effect related to use of this product. For detailed benefit and risk information, please consult the IFU.